his pelvis. Appendicitis. Incidental finding of a 7 monostosis, bone island, in his ilia. Most appropriate follow-up. None. Musculoskeletal and trauma radiology. Paper 1. 1A. Young patient with short limbs. Lumbar and thoracic spine. Posterior scalloping. Which chondroplasia is he most likely to have? Musculoskeletal and trauma radiology. Paper 3. 1. Back ache. HLA-B 27 positive SI. Joints. Extensive sclerosis and erosions. Ankylosing spondylitis. 2. Elderly woman. Pain in her left hip. X-ray flattening and collapse of left femoral head consistent with avascular necrosis. Most sensitive in diagnosing avascular necrosis, AVN, of the hip. MRI. 3. Known sickle cell disease. Severe pain in his right thigh. Plain radiographs. Bone infarct. Appearance. Diminished uptake in medullary res. 4. Flowing ossification of 6 thoracic vertebral bodies. Most likely on imaging. Ossification of patellar ligament. 5. A 7-year-old boy who is known to have Zero-Lear's disease presence with a solid lump close to his knee. What radiological finding is likely? Cartilaginous rest. 6. Histologically confirmed prostate cancer following an ultrasound-guided biopsy. Increasing lower back pain. Single best form of appropriate imaging. Radionuclide whole body bone scan. 7. Chronic back pain. A 61-year-old female MR shows patchy low signal in the first sacral segment with loss of height. Bone scan shows sacral uptake in an H-shaped configuration. Diagnosis? Insufficiency fracture. 8. What is a typical feature of a joint affected by gout? Joint space preserved until late in disease. 9. Pain in both wrists and ankles. Hypertrophic osteoarthropathy, HOA. Bronchiectasis. 10. A 50-year-old man is known to have hemochromatosis and presents with pain in his hands. What finding would be typical? Chondrocalcinosis. 11. Plain radiographs. Bands of increased density at metaphyses of tubular bones and a bone-in-bone appearance. Cause. Lead poisoning. 12. X-rays flowing ossification within a dermatomal distribution. Fibrosis of overlying skin is typical. 13. What feature would be in keeping with a Charcot joint? Loose bodies. 14. Rectangular phalanges in the hands and ribbon ribs, pleural effusion, and pericardial effusion. Diagnosis? Still disease. 15. Small loosened lines at right angles to the cortex on the medial border of the proximal femoral shaft were visible bilaterally. Diagnosis? Fibrous dysplasia. 16. Osteoporosis of the hip joint and loss of the subchondral cortex of the femoral head with preservation of the joint space. Diagnosis? Transient osteoporosis. 17. An overweight 13-year-old boy presented with hip pain. He gave no history of trauma and a radiograph showed widening and irregularity of the capital femoral epiphysis. Several weeks later he represented with worsening symptoms and a repeat radiograph showed displacement of the femoral head. In what direction is it likely the femoral head has displaced? Posteromedial. 18. Skin rash on his face. History of a left knee injury. Plain film showed multiple sclerotic lesions in the skull. Similar sclerotic lesions with a periosteel reaction in the long bones of his leg and cystic lesions in the distal phalanges of his foot. Diagnosis? Tuberous sclerosis. 19. Foot pain diagnosed. Italo-calcaneal coalition bony union across middle facet. 20. Marked calcification and loss of height of multiple intervertebral discs, predominantly in the lumbar spine. Knee. Premature osteoarthritic changes with pronounced chondrocalcinosis. Achronosis. 21. A 67-year-old woman with back pain is investigated with an MRI scan and areas of increased bone marrow signal on T2 weighted images are noted. What is a possible cause? Radiotherapy. 22. Injury to her left loin. Bruising and severe pain in her loin extending to her back and a urine dipstick showed the presence of microscopic hematuria. Best investigation. Contrast enhanced CT. 23. A 32-year-old motorcyclist presented with blood at the urethral meatus. What is the most effective examination to exclude urethral trauma? Retrograde urethrophy. 24. The best investigation to exclude a scaphoid fracture. MRI within 24 hours. 25. An elderly man on warfarin treatment for atrial fibrillation is found at the bottom of a flight of 10 stairs with widespread bruising to his arms and face. On transfer to the emergency department he was confused but is otherwise neurologically intact. Moving all 4 limbs and opening his eyes spontaneously. What is the most appropriate investigation? Urgent CT head. 26. A 10-year-old boy fell off a climbing frame onto the ground and injured his left elbow. He was assessed in the emergency department, and AP and lateral radiographs of his elbow were taken. What finding would be indicative of a fracture? Visible posterior fat pad. 27 Osteoporosis diagnosed on a DEXA scan. Pain and restricted movement in her right arm. Injury is most likely to be visible. Fracture of surgical neck of humerus. 28 Non-accidental injury. Fracture of left 7th rib posteriorly. 29 MR. A linear band of high signal in a structure just distal to the ulnar styloid. What structure is most likely to have been damaged? Triangular fibrocartilage. 30 Physiotherapy for treatment of a long-standing knee problem. There is flattening and cortical irregularity of the lateral surface of the medial femoral condyles. Bilaterally subchondral cysts and subchondral sclerosis are present. More marked on the right side. Diagnosis: osteochondritis dissecans. 31 Fell from a swing onto his outstretched hand. Abnormality: torus fracture of distal third of the radius. 32 Road traffic accident. Microscopic hematuria. What are fast ultrasound studies able to detect? There is a sensitivity of 40% for the detection of solid organ injuries. 33 High-speed road traffic accident. Back pain. Vertebral fracture. Likely level of the fracture: L1. 34 Anterior knee instability with a positive anterior drawer and McMurray test. A small bony fragment just lateral to the lateral tibial plateau. Most likely combination of findings: medial meniscus, anterior cruciate ligament tear and Segon fracture. 35 Sensation of his right shoulder popping out. An anterior dislocatio. Which nerve should be examined? Axillary nerve.
और ये डिजीज है तो एक और नाम पे ग्रोथ में नहीं तो नी की जब कैटल है कार्टेज है तो कार्टेज ठीक है गोट में जॉइंट पेज प्रिजर्व अंटिल द डेट और वह आर्बिट्राइव ऑर्थोपैथी इससे क्या होता है क्योंकि केसेस होती थी या बिनाइन लंग लेशन होती है तो ये पेशेंट हमें कोमाटोसिस पेन इन हैंड और टिपिकल इसमें कॉर्नोकैशनल वीडियो होती है कोमाटोसिस में कंजगेन होती है ठीक है उसके लिए हम देखेंगे जब उसको डायग्नोज करेंगे तो फिर कंसिडर देखेंगे और दोनों पेन वाले से ब्रीड कॉइन में ये पर ऑस्टियोपोरोसिस में भी फोरन पोर अपीयरेंस है Sharper joint loose body होती है sharp का टूट जाती है और loose body बन जाती है तो primary phalanges and has ribbon ribs ये है still ठीक है ये acute form of renal rheumatoid है cause scenario 4 month का होगा ये still point with hip pain displaying of your head तो ये posterior medial होती है ठीक है ये ध्यान से कि posterior lateral बहुत दूर है ना तो ये फ्रैक्चर में होगा लेकिन पोस्टीरियर होती है SUSE में तो ये ट्यूबल में और फाइंडिंग की है कि जो इसके रिगार्ड में रहता है और कंजर्वेटिव कंटेंट जो है तो ये टेक्निकल ट्यूबल होती है जरूरी नहीं है कि वही सब कॉर्टिकल ट्यूबर्स जब अप एंड डाउन ट्रायल ट्रांसफर हमें जरूरी बहुत बताएंगे ये भी एक और नया सिनेरियो इस सिनेरियो में जब बहुत हाई मल्टीपल ग्रुप डिस्क है तो उनको ठीक है एक कन्वर्जन ऑफ द मैरो ज्वाइंट पे है तो मतलब यूट्राइट एंट्री यूट्राइट में जैसे ठीक स्कैन कर सकते हैं यूट्राइट एंट्री टिप्स चेक नहीं कर सकते हैं अंडरस्टैंड सेलेक्ट आगे टाइम रिकवरी करते हैं ठीक है Option orbit shattered है A apophysitis optical tubercle और इसमें finding है ये osteochondritis बन चुकी है string on outstretched hand सेल है तो 845 रेडियस है, ठीक है। ये काफी ये बच्चों में लगाते हैं। ये बोनिक फ्रैगमेंट ऑफ लाइट के लिए सी कॉन्ट्रैक्टर है, ठीक है। फिर इसके साथ एसोसिएटेड है मीडियल मेनिस्कस एंड एंटीरियर कोक्लेयर लिगामेंट, ठीक है।